Good evening, ladies and gentlemen, and welcome to KNDI ATRI Live. So today's focus is going to be on the future of nutrition and dietetics, where currently the profession is evolving. We're going to look at nutrition and dietetics professional qualification and competency certification, which will be discussed by Dr. David Omondi Okeyo, the Chief Executive Officer of Kenya Nutritionists and Dieticians Institute. Welcome, Dr. And you can proceed to give us a brief overview before we proceed to our first question.
Thank you very much, Laura. I'm very glad this evening. And first of all, I would want to congratulate you for the series of discussions and conversations we have had before.
Thank you, Doc.
And I think if we continue like this, we are going to pass knowledge outside there.
Yeah.
So that everyone who is a key player in this game and also in this area of service delivery can be well versed with knowledge when it comes to matters of nutrition and dietetics, professionalism.
Okay.
So today I think it is with a brief that I would want to say that we are in an area where we want to discuss more about professional qualifications and competencies.
Yes.
And just to begin the process before we get deeper into the questions and answer, I would want to say that looking at the history of nutrition and dietetics in this country, this cadre started from a perspective that was not well understood in the country. For example, most of the times people only knew scientists that were called home economists or domestic scientists. And basically it was meant for women. Majority of them were women. So anybody who was supposed to do home economics was actually focused towards domestic science.
Okay.
It grew, and at some point, Karen started training the so-called community nutritionists. And then we came up with the cadre that were somehow labeled as nutritionists, but more so very focused towards the kitchen. And so it was not well understood as science. And later on, it grew to what we call the home science and technology. And then from the home science and technology, we came to nutrition and dietetics. So the profession of nutrition and dietetics has not been recognized professionally for quite some time until in the recent past when an act of parliament was instituted by His Excellency, the late Mwai Kibaki. And that was when we came up with the human nutrition and dietetics regulation. And this act then brought on board the current cohort of professionals called nutritionists and dietitians. Most of them were taught by people who actually went through home science or home economics, but later on went to master and PhD in nutrition and dietetics. So right now, we have now come to terms with the current policies that will define exactly who the professional is as human nutritionist and dietitian in every category, and their qualification, and also their competency. That is well defined. And I think today that is what we need to bring on board for the members of the public and also for policymakers to get to understand in the field of nutrition and dietetics. And before I close, I want to say that right now it is a cadre that is classified to be under medical profession. So nutritionists and dietitians are medical professionals. Okay. And I'll be talking about that in a short way. Thank you.
Okay. Thank you, Dr. So let me begin here. Many viewers today are hearing the term competency-based certification for the first time. In simple terms, what does this mean?
Thank you. When you talk about competency-based, competency is all about skills and then delivery of service in line with the skills acquired.
Mm.
So we know that many professionals that are now registered and licensed, they have gone through a training where they have acquired theoretical knowledge from their respective colleges and universities.
Mm.
By the time they come out, they are full of theoretical knowledge and some basic competencies, depending on how how much time they took on hands-on, particularly during field attachment and which they used to call industrial attachment, and also clinical placement.
Mm.
But when it comes to competency, then that is a professionally defined core skills that are put into use for service delivery. Now, when we talk of core skills, we are talking about different areas of service delivery that are critical, that we want our professional to specialize in. So beyond the theoretical knowledge and basic skills, again, during hands-on experience, we now focus more on detailed competence with specificity to service delivery that target some specific outcomes. So you'll find that after somebody has graduated, then they have to really specialize so that they become now real competence. Just like when you go to the field of mechanics, you'll see that after theoretical knowledge, now we want people who can actually deliver in the repairs of cars, for example.
Mm-hmm.
So the nutritionists that are competent are those that actually can deliver with specificity and, of course, with accuracy that is required to reverse a negative health problem that exists among the clients or patients. So when you're competent, it means you have skills that can now be proven to be valid in terms of service delivery. And those skills are what defines your competence. Yeah. So it is far much different from the acquired theoretical knowledge and basic skills. Yeah.
Could you maybe highlight to us what are some of these key practical skills and competencies that professionals now need beyond classroom learning?
I would not want to bring in the competence because of the fact that that would get into the details of looking at the area of practice and then getting deeper into how that area of practice would require skills to be applied. But I still want to define and characterize our professionals so that the members of the public can know who are those that are competent and who are those that are qualified. So I will start with the qualification first, then I get into the competency. Now, qualification is at the periphery towards the actual training that they undergo, and of course, getting into the professional qualification, which means that they are now taking their line. But competency now goes beyond the line that they have chosen to service delivery. Yes. So looking at the qualification, first of all, any student that is admitted into a university to undertake or pursue human nutrition and dietetics at degree level, when they graduate, they have theoretical knowledge on human nutrition and dietetics. So when they come for licensure, they have to be specialized. So currently we have defined a policy that is going to take root soon. Of course, we did that through internship before, but now it has changed to a qualification policy where we have defined those professionals that we say are qualified at every level of training. So starting with a degree, we have 6 levels of qualification. The first level is community nutrition qualification. That gives us community nutritionist. The second one is public health nutrition qualification that gives us public health nutritionist. Then we also have food science nutritionist. Those are qualification. Then clinical nutritionist, and then clinical dietitian. And then we have food service diet therapist. Now, those are 6 qualifications for a degree. Now, in the current system of service delivery, whether at the county or at the national hospital facilities, the classification for degree is just nutrition officers.
Yes.
So anybody who has graduated is classified and grouped under nutrition officer.
Yeah.
Now, we are telling the public that that has changed because that is a knowledge that was there before in 2 decades in the past.
Okay.
Right now, the nutrition officers are in 6 categories of qualification. So anybody who has graduated for human nutrition and dietetics can choose to either fall in the 6 categories. And how do they do that? They have to undertake a course. So that course will be focused towards every area of qualification for a period of 6 months, so that you can now pass, just like in the legal fraternity, once the lawyers graduate, they go through Kenya School of Law, so that they can pass to be admitted into the team of advocates, that is admitted into the bar. So for this case now, our nutritionist will only be licensed after they have passed these particular courses, which will be purely practical oriented. Now, in the level of certificates, diploma,
Yes.
we have 2 categories of qualifications. We have nutrition technologist and dietitian technologies. Again, those ones will have to undertake examination, at least a course for 3 months, and then they undertake professional examination in that line. And then we'll have now the lowest category, which are the technicians, that is those who have done certificates. These ones will only undergo professional examination screening. And once they do that, they will be admitted as technicians. So these are the qualifications we are talking about. And these ones will only define a line for every professional who has graduated at every level of what they need to pursue for the rest of their lives. And for the degree purpose, we would request, and of course, those who are offering services to take cognizance of this, particularly the Public Service Commission, to get to know this along with the line ministries that are offering these services, to take charge in terms of reclassification when it comes to the schemes of service, so that we can have this group of professionals qualified, aligned with the current areas of practice. Now, when it comes to clinical nutritionists, for example, just as one case, they will have a well-defined job description. So I want to give an example of a high-level hospital, let's say level 6.
Yes.
Now, a level 6 hospital should actually have 4 different categories of nutritionists who are graduates. They need a clinical nutritionist, a clinical dietitian, a food service diet therapist, and they also need a food science nutritionist. Now look at the parenteral feeds and enteral feeds that we have in the facilities.
Yes.
Who takes charge of them in terms of content? Probably the pharmacists think that they are chemicals or drugs or they are medicine. But those are purely food, which require proper grounding of food science knowledge. And therefore, the person that would give an assurance in terms of quality of the procured products in such category is actually a food scientist. Now, when it comes to the mixing, is also a competency required from a food scientist, or a skill required from a food scientist, or a qualification for that matter. Now, for a clinical nutritionist, that is actually the person that currently is working in the most health facilities. They do everything, including assessment up to the level of ensuring that feeding takes place. But that's not their job. For a clinical nutritionist, they have to focus more on diagnosis, assessment, screening, making referrals, and particularly trying to also educate at basic level. While A dietitian, for example, is supposed to be looking at the diagnosis of a clinical nutritionist and coming up with a dietary plan based on food exchanges. And then this is passed to the kitchen, where a food service diet therapist will check whether the food that has been planned has been prepared according to the specifications that were given by the dietitian. This kind of workflow is not yet in our health facilities.
No.
But an ideal health facility should actually have 4 nutritionists that are qualified in 4 areas. That is clinical nutritionist, clinical dietitian, food service diet therapist, and also food science. Now, this special food science, food service diet therapist is one creature that you'll never find in any hospital. Because, yes, the caterers cook, but the cooking is supposed to be guided by the diet plan and the menu plans. And this is the work of a food service diet therapist, including delivery of that food at the bedside and monitoring how that food is consumed. Many times, people consume food in the hospital, some are returned, but nobody questions why was it returned. There's no an evaluation that is done at the bedside to indicate the reasons why this was not done. That is the work of a food service diet therapist to monitor. Even in terms of display, merchandising, and of course, plate arrangement is the work of a food service diet therapist. So we don't have that. So if you were to go to a high-class hospital, you would expect these 4 to be working there. Okay. Now, I want to move now to the competency, because I think that is what you were looking for. When it comes to competency, any of these qualified nutritionists would want to build competencies in subspecialty areas. So when we talk of subspecialty, we are talking about those critical hands-on skills, knowledge, and of course, the service delivery needed for a specific condition. So in the competency field, we have brought on board additional course descriptions and what we call the apprenticeship that would admit all these qualified nutritionists into different specialties. For example, we have renal nutritionists. You know, these are all nutritionists that are qualified in all these categories, but they have built their skills on renal nutrition, nutrition applied to the kidney functions. So these people have worked in these areas with different patients, and they have now built competency to deliver that service in renal wards, for example. That is a competent nutritionist. So that's our competencies that we are referring to here. Think about pediatric nutritionists, somebody who has worked with children for quite some time on hands-on, and have also undergone some rigorous course training in pediatrics, will become a pediatric nutritionist. But they are all human nutritionists and dietitians qualified in the categories I've defined. If you think about a nutritionist like critical care nutritionists, those who work in the kidney, they are purely qualified nutritionists, but now their focus is on dealing with patients in ICU. So they have to find how patients in ICU can feed and come out when they are healthy. And of course, we have many others, like when you talk about holistic nutrition, which looks at pathophysiology of disease and see how best the food combination can be used as natural treatment without necessarily looking at the medical aspect of it. Those are competencies now built at a higher stage. And we have seen things like oncology nutrition, for nutrition specific for cancer. So those who have really worked in cancer wards and also trained to focus on a cancer patients. Those are competencies. And then we have other competencies which look at the policy aspect, looking at leadership and emotional intelligence, the soft skills that are not there. Those are competencies. Of course, we talk of when it comes to looking at people who really do well, people who really do well in service delivery and recognizing them. Those are competencies. So competencies are beyond the qualification and training that we acquire in various colleges. So why we are now going towards competency is because we want the public to receive accurate service delivery, quality service delivery with a lot of safety consciousness. Right now, everybody who has come from college, for example, yes, they will have enough knowledge that they have acquired theoretically and some basic skills that they have acquired during field attachment, but they're not competent enough to deliver a service at a critical care need, demand.
Yes.
They also are not well equipped enough with soft skills that they can maneuver challenges that take place in the hospital facility. So beyond their qualification, they now have to build their competencies. And we have provided that platform here at KNDI, where we will be awarding certificates for people who have gone through that rigorous process to become competent. And we'll be identifying them for the members of the public to know their locations and identity, so that if you're looking for an oncology nutritionist, we can actually find one or two in a particular area with their offices, with a board written oncology nutritionist. But they must be first trained and then qualified, and then they're built within the domains of the competency. Yeah.
Thank you so much, Doc. That was very comprehensive. It's very clear that there is qualification and competency based. So based on that, as the profession continues to evolve, there's this aspect of continuous professional development.
Yeah.
How will it come into play when it comes to now competency, renewing licenses when you're competent?
Thank you. Continuing professional development is actually CPD.
Yes.
Which is a requirement for any profession that wants to produce professionals that are up to date. Yes. With the skills and, of course, knowledge and competencies. Before that, I would want to talk about a very special category of qualification group within the nutrition fraternity. You know, many times we have only looked at the nutritionists that are working in the health facilities. But if you look at the fraternity of nutrition, we have those who are engaged in research activities. Yes. Some of them are in research institutions, some are in the universities, some are doing their own personal researches. We have never bothered before to classify them in terms of their level of acquisition of knowledge and also their experience. So I would also want to inform the public of the same, without forgetting, before I get to the CPD, to tell them that we have now also introduced a scientist category. Yes. In the fraternity of nutrition. And here we have those that have done masters that we call scientist class A. These are people that really, they have, in addition to their basic degree, undergraduate program, BSc, they have now gone to acquire masters. And they have tried to publish a few papers here and there. We also have the senior scientist class B. These ones, we can call them those who have acquired their PhD recently, and of course have published a few and have been engaged in a few grants here and there. And then we have a research scientist. This classification is actually in our policy. And the research scientist here, class C, we are talking about people who holds PhD, have published at least 15, have supervised master students. And then we have senior research scientists. Yes. That are called class D. So the class D here, we are talking about people holding PhDs and have gone through the processes of publishing, acquiring grants in the area of nutrition and dietetics, supervising masters, supervising PhDs, have over 10 years experience. Yes. Then now we have the advanced ones who are equivalent of a full professor in a university. These ones have really shown that they have worked hard in nutrition area by bringing grants, mentorship, and all those classifications needed. Now, in this classification, from junior scientist to research scientist to senior research scientist, we have come up with a criteria where the award can be done by a jury. This is a team of experts that can look at their competencies. So that one is now at KNDI, and very soon we will be rolling out this policy so that the professionals can be aware and they can begin to apply. And if they merit, they will be classified. This will also be put in legal notices so that it becomes a public document that is legal for purposes of translations, particularly when they cross from the research institutions to universities, and when they come from the universities again to research institutions. So this will be very easy. So let me come back now to the CPD.
Yes.
Now, any professional that has been trained and then taken through qualification and then competency built in a specific area must maintain that status. So you may call yourself a clinical nutritionist, but if you don't engage in further trainings and also engage in activities that will make you fully grounded in that area, then that qualification can actually be withdrawn. And sometimes you can be subjected again into qualification examinations to be approved that you are still relevant. The same applies to competency. If you tell us that you are a renal nutritionist and you are not engaging much in the practice of renal, or you are not doing, continuing to train in the area of renal, or even setting up, doing research in the area of renal, and coming up with new ways of attending to cases, then it can actually be withdrawn. So when it comes to continuing professional development, we have set up a minimum of 42 hours equivalent, or 14 points. 1 point is equals to 3 hours of training relevant for that area for which you are qualified, and also in the area for which you are competent. So when we will be awarding the CPD for purposes of retention, we will not be allowing those who go to do programs from other areas to be awarded CPT within the areas for which they are qualified or competent. So it will be relevant for that area for you to be retained. And this is starting from this year. So we want the professionals to keep on updating their knowledge in the area for which they have chosen to take as a track of their service delivery, either as qualified professionals or as competent professionals. So the CPD is going to be mandatory because we must keep knowledge. Right now, if you go to the universities, for example, yes, we say people are doctors, professors, but there are professors that now forgot about further studies. They are not improving themselves in their area so that they can deliver effectively. Now they are now used to the name full professor, but you don't see additional value being added from their area of expertise. We rarely see inaugural lectures, which used to be there before, where a professor would come up with a message for the public and it would be attended by everybody. There are very few from the universities. We're not seeing people coming up to talk about their researches that they are doing and how many PhDs is under them. Are under them, how many masters under them. If you go to countries like Germany, for example, you'll find that a professor has a good pyramid of those that are being mentored under them. So we no longer see this. Now, also in our profession, we want to see people mentoring young ones by becoming gurus in their competent areas and qualified areas so that they can admit the young ones to also follow suit in that line. And that is why the CPD becomes now very important, so that we can know that you are up to date with knowledge. And so recommendation can be made when you continuously score above the minimum required for CPD. That will help us in the mentorship process and also in bringing up key personnel that can improve the nutrition sector in this country. Thank you very much.
Thank you. As we wrap up this, maybe before we bring it to an end, is there anything else you'd want to add as a regulator, just to advise the professionals and the students currently pursuing nutrition and dietetics?
Yes, one thing I would want to particularly inform the current students that are still undergoing pre-service training, particularly those who are in third year, that they should get prepared for qualification examination. Right now, we have incorporated and concentrated the internship program, which is in the Act, during the pre-service.
Yes.
We have also prepared ways by which we are going to respond to the competency-based trainees in grade 10. But for those who are in third year, we want to assure you that come next year, you shall be undergoing a 6-month training in qualification area as prescribed in this policy. Also, we would want to encourage you that we have partnerships with the nutrition programs like the KNDI that offer competency-based training for a year for those who are already qualified. You can join such so that you can build your competency. For us at KNDI, we'll be conducting oral examinations and written examination on the same as the examining body for KNDI and any other partner that comes in the training of competencies. Also, as KNDI, we have national competency training areas. Like very soon, we shall be launching holistic nutrition and natural treatment, which is a very specialized course, and also sports nutrition. So they should keep watching the pace so that they can pick the relevant area for nutrition competence they want to build. And particularly for sports, we have so many athletes in this country and people playing football.
Yes.
But who is there to attend to them? We need to bring those kind of creatures that are going to focus more on looking at the sports aspect and physical activities in the country. Thank you very much. That's the advice I can give.
Thank you so much, Dr. Okeyo. To our viewers, thank you for staying tuned up to now. We have come to the end of today's session. Remember to always tune in every Thursday, 5 to 6 p.m. Goodbye from your host, Wangara Laura.